Transcarotid artery revascularization, or TCAR, is a minimally invasive procedure to treat artery disease and help prevent future strokes. Well, joining us now with more is neurosurgeon Dr. Bekelis, the chairman of the Neuro-Interventional Services at Catholic Health. I got the first three words right, but that word was a little harder. Welcome, doctor. Thank you. I'm so glad you're with us today.
Thank you for having me.
So you recently performed this new procedure at the Stroke and Brain Aneurysm Center at Good Sam Hospital. What exactly is this procedure? Walk us through it a little bit.
So it's a procedure to treat carotid disease. So carotid disease, one of the biggest blood vessels that feeds the brain, can build up plaque, atherosclerosis, and frequently that plaque can break off, go into the brain, cause a blockage and a stroke. When that happens, or before it happens, we can prevent it from happening by treating the problem. And in the past, there are two traditional ways to address carotid plaque buildup or atherosclerosis. One was by open surgery, where we would make a skin incision and remove the plaque entirely, and the other was with a stent, either through the groin or through the wrist. Now, both of these procedures had their respective challenges. The procedure, the open procedure, obviously was an invasive procedure, whereas the stent carried a higher risk of stroke because we had to go through the blocked area without any protection. So you could knock off a piece of plaque into the brain, and that obviously could cause a stroke. So, where TCAR comes into play, and TCAR stands for transcarotid artery revascularization, is it allows us to go in the common carotid artery with a small incision in the neck and navigate our stent through the blocked area while reversing the flow, as you can see in your schematic, while reversing the flow of the carotid artery. So while you're working in the area of the problem, the blood doesn't flow towards the brain, but flows the opposite direction, allowing us to capture any debris in a filter that we have outside of the body. And that's kind of a hybrid between the endarterectomy, the open approach, and you see here the flow reversal and the deployment of the stent, or the endovascular procedure, which is the stent placement. So this allows us to take advantage of the positives of both worlds. And, it's a minimally invasive procedure, as you see, with a small incision. And ultimately, this has the best result for the patient.
Now, is there a type of patient that will benefit more from this procedure, or is it really something that any patient can undergo?
So all patients can benefit from this procedure except the patients that have a very calcified plaque. So if there's a lot of calcium, and so a hard plaque in the carotid artery, that would be a challenge for us to open with a stent and a balloon. And so these would not be good candidates for this procedure. Those patients would still need open surgery, the endarterectomy. So that would be the only subgroup of patients that would not benefit from TCAR. But by and large, all other patient populations that need carotid intervention would benefit. And those patient populations are folks with significant carotid disease without a stroke, that is over 70 to 80% blocked carotid artery in the neck, but haven't had a stroke yet, so you can prevent them from ever having one, or folks that have had a stroke and have an over 50 to 70% blockage in the carotid artery. These are the two large groups that we intervene on.
So can this be done at any hospital, or do we need a certain type of technology? Where are we seeing this being done?
So this is a procedure, obviously, that needs to be done in specialized centers that have the knowledge and the capability to perform it. Ideally, we would say it would need to be performed in a comprehensive stroke center like Good Samaritan Hospital, which is currently the only comprehensive stroke center in the South Shore of Long Island. And the reason for that is that we have the ability not only to perform these procedures in advanced environments like a biplane machine where we can see multiple ways into somebody's brain and have constant feedback and information that allows us to really accurately pinpoint the problems and address them at that time. But also it allows us any potential complications to address immediately. Any downstream blockages, any embolizations, any strokes. we can address at the same time. And also these patients can then go to the neurointensive care unit for overnight observation. Again, only available in comprehensive stroke centers.
Well, it truly is amazing. I watched that video last night, and it astounds me that we're able to do so many wonderful things, and we're very grateful to be able to do that here in our own Catholic health system. Maybe just before I let you go, I think as we're talking about strokes, some reminder for people, what are the warning signs that someone might be undergoing a stroke?
Well, that's a great question, because I like to say that what we do on the back end, is glorified plumbing. What happens in the front end, identifying the stroke, is really what can make the difference between a life of disability or death and a life free of any symptoms. And the most important thing that you can do when it comes to stroke is identify it and seek care as quickly as possible. And identifying stroke is simple. The American Heart Association has created an acronym called FAST, and FAST stands for face, arm, speech. It's time to call 911. So if somebody is experiencing issues with a droopy face, inability to speak, inability to move, an arm or a leg, it's time to call 911. If you're the one experiencing these symptoms and you're of the mental ability to do it, then you should absolutely do it. If you see somebody that's experiencing that, then you can really save a life by calling 911. And again, time is of the essence, so don't ignore these symptoms. Don't wait for the symptoms to go away. The quicker you come and receive either medications or endovascular surgical interventions to reverse the impact of the stroke, the more likely you are to have no disability. And we always say that it's better to be overly aggressive with these things and seek medical attention, even if it's a false alarm, than to not, and then obviously be left with a permanent disability.
Well, thank you, Dr. Bekelis. Really proud of the work that you're doing, that Catholic Health is doing, and thanks so much for sharing with us this exciting new technology.
Our pleasure. Thank you for having me.